Hello, this video will be going through what covered services are, what they mean, how they impact your ability to get care within your insurance. And so, in addition to that, I will go through what the 10 essential health benefits are, preventative and wellness health services, as well as costs. And so a covered service is a service or item that is included in your plan. It means that your insurance will help cover some, if not all, of the cost. In addition, you cannot be denied for a service or item that is covered. So just because you use your insurance, that doesn't mean you can be denied assistance. And your cost depends on a lot of different factors. And so the essential health benefits, this is a set of 10 categories of services and items that your health insurance plans must cover under the Affordable Care Act. And so this ensures that there's a minimum baseline requirement that all plans must include in order to be able to offer plans to consumers. And this allows a sort of, again, a baseline of coverage that you know that you will be getting these services for the most part between states as well as between plans and whoever provides you these plans. And so these are the 10 categories, and you could search them up or as well as look into your own health insurance plan to see what specific services are actually covered and what are not covered within these categories. And so what plans include and follow the essential health benefits? Most plans do, so those on a marketplace, either federal or state, because some states refer residents to look for insurance on the healthcare.gov, the federal exchange, and other states have their own state exchange that they have residents look into for insurance, and so both of those locations need plans to follow this to be provided on the websites. Individual plans, so you or your family directly being insured with a health insurance company, those must follow these EHBs, as well as employer provided. So if your employer contracts with a health insurance company to provide you insurance, those plans need to cover these categories. There are always a few exceptions, so in case your plan is one of those, just always refer back to your plan. So give them a call, check on your online portal just to make sure that you know which services are going to be covered to some extent or completely for you, and to make sure you know what services you can get assistance for. And so the cost of covered services vary, and this depends on your plan type. So depending on how much your plan has offered to assist you, so it could be 90% of services, or the cost of services could be 80% of the cost of services. And so again, always check in with your insurance plan to see what those requirements are. And your cost also depends on your deductible, copay, coinsurance, and your out-of-pocket maximum status, which I will go through in more detail in one of the next videos. And so there is a unique category called preventative and wellness services. These are unique because they're free of charge to you. These include routine care and preventative services that you do not need to hit a certain amount of money that you've put into your insurance to get these for free. Instead, these are free of charge. And so just to remember, you always want to receive these in-network to make sure that they are covered and completely covered in this case. And so these are just some examples of preventative and wellness services, like yearly wellness checks or women visits, as well as screenings for diseases and immunization vaccines. Also, contraception can be provided as a preventative service or wellness service, and so you just want to check to see that your plan actually does provide this, because religious plans can deny you that service and it just is not covered. So then you would have to pay fully out of pocket for those things. So just, again, double check with your insurance plan. So the situations in which you would want to call your insurance or go online to your health portal would be if you're interested in learning about a list of covered services to you, so go ahead and do that. If you need to get a particular service done because your provider says you need it, give your insurance a call if you aren't already aware of whether or not it is covered. And then also, if you want to go ahead and do a service, but you're not sure of what it would cost you, and maybe you have some cost restraints, you want to go ahead and call, and they can kind of give you, your insurance specifically will be able to give you a more precise estimation of what your cost will be. But again, after you see a physician or a provider and you get a service done, negotiations happen between your insurance and the provider for you to get a bill, and then after that, there's a lot of factors that affect what you actually pay. And in addition, you want to ask to see what services are free and preventative, so it would help you in the long run to get these services, potentially if you fall into the category of someone who needs this, like a screening for certain things. And so go ahead and call just to make sure you're getting those services that you qualify for. So essentially, we went through the 10 essential health benefits as describing them to be the minimum requirements for a health insurance plan to cover. In addition, not all services in a category that is said to be covered will be covered, and the cost varies from a various number of factors. So always check in with your health insurance to see the cost of service you will get.